Hi, Dr. Tyler Williams here. Today I want to answer a question that I'm asked every single day, which is, how do I stop getting cavities? Seems simple enough, but if you're someone who you feel like you take good care of your mouth, you brush, you try to eat right, you don't eat a lot of candy or sweets, and yet still you get unforeseen dental bills, or you have bad breath, or it seems like every time you come into the office you have more bugs eating holes in your teeth. Well, I'll share a few tips today that should help you out. So what we've discovered in research and in my practice is that there's some simple steps you can do every day. And personally, I've used this system, and I haven't had a cavity for over 7 years using this system. So here's the 4 things I do every day. The first one is I use a mouth rinse. So every morning when I wake up, I use a xylitol and fluoride mouth rinse. And so that way, all the bacteria that's in our mouth throughout the night, we can wash that away. It also freshens our breath, and it can even help us avoid things like coughs or colds. The second thing I do is I drink lots of water throughout the day. So water is the best, most inexpensive, and most abundant solution to a lot of our problems, but especially our teeth. If we're drinking water throughout the day and really in between meals, it helps wash away the acids and the starches quicker on foods we eat. Now you may be saying, well, I don't eat a lot of sweets, but even things like whole grains, even fruits and vegetables can leave behind starches that can produce acid and break down our teeth. So water's great. Third thing is I use xylitol products. And if you're not familiar with xylitol, it's a sugar that comes from plants such as birch trees or corn. Even our bodies naturally produce its own xylitol. But xylitol is a sugar, it's a natural occurring sugar, and it actually helps strengthen our teeth and fight bacteria. It's also great for our sinus. You can buy xylitol nasal sprays, or particularly in our dental office, we use a lot of the xylitol mints, candies, gum, mouth rinses, toothpaste, and it's nature's natural sugar to help fight bacteria and decay. So I give it to my kids. It's safe for diabetics, adults. You just don't want your pets to get into it because it can make dogs very sick. It's hard on their stomach, but for humans, it's really, really great. It tastes great because it's natural, and using that between meals really helps. The fourth thing is flossing and brushing. Okay, now most people brush, but most people don't floss. So I floss once a day, and do it at night. It takes about 1 minute. It might seem like it takes a lot longer, but it only takes a minute or so, and doing that once a day cleans an extra 30% of our teeth. So if you just brush without flossing, you're missing anywhere from 30 to 40% of the surface of your teeth. So my patients who have the healthiest mouth and least amount of cavities, they floss at least once a day. Brushing should be done twice a day. 3 is okay, 4 may be overkill. But when you brush, do it for 2 minutes. I prefer an electric brush. I really like the Sonicare, is my favorite. Or the Oral-B Triumph is another good one right now. But those electric brushes are nice too, because we can't cheat, because they have timers that go for 2 minutes. So in studies, we found that the average person only brushes for about 45 seconds, even when we think we're doing it much longer. So by using the electric toothbrush, not only does it vibrate and clean below our gums better than most of us can do with a manual brush, but it also has the timer. And some of the newer ones have Bluetooth, which is great. You can put those apps on your phone or iPad for your kids or teenagers, and it'll automatically track how often they're using it. And also a sensor, so that if we push too hard, it will shut off, because something we're guilty of adults a lot is brushing too hard. The rule of twos for brushing is 2 minutes twice a day. That's 4 minutes out of your day in total if you're a twice a day brusher. And then don't eat or drink or rinse for 20 minutes. So most of us know that toothpaste cleans teeth, but what many people don't know is that the minerals in our toothpaste, if they stay on contact with our enamel, or any sensitive areas of our teeth for at least 20 minutes without eating or drinking or chewing, we'll get a lot better result as far as enamel strengthening, putting minerals in our teeth, decreasing sensitivity, and especially cutting down on those annoying bacteria that eat away at our teeth. The fifth tip is a bonus, which is using a water pick or an air floss. You could do that in the morning and floss at night, or you could floss in the morning and do the water pick at night. But string flossing we still find is the very best, but a close second is using a oral irrigator like the water pick or air flosser. Using those once a day can help as well. Two other things that I do that you can't do at home, but your dental professional can help out is one is make sure you get regular checkups if you find things when they're small. A lot of times we can do something preventative, or apply a mineral varnish, or do some type of treatment to the tooth to prevent a root canal or a painful infection. The second thing are dental sealants. Most kids these days are getting sealants, but we're finding that adults are really doing well. In fact, a study found that adults who have their teeth sealed get up to 15 years of benefits. So when I was between age 6 and 12, I had most of my back teeth sealed, and the past few years I've been getting the sealants that have worn down, or the teeth that weren't sealed, I've been getting those sealed, and that really helps. And as I said, doing these things has helped me stay cavity free for over 7 years. Hope you enjoyed these tips, and if we can help in any way, please give me a call. Also, if you'd like to set up a free oral health consultation, where we can sit down and go through your diet, your home tips, spend some time with my hygienist and myself, and see what we can do to help you out. We'd love to meet with you for that. They are limited to just a few per week, so you can call for earliest availability. You can call me at the number below or contact us on our website, and I look forward to hearing from you soon. Thanks.